Greetings, thank you for lending an ear to the Voice of the Times for Friday, December 31, 2021. For today's editorial, bracing for a COVID tsunami. The health experts called it, and now it's here. The Department of Health or DOH and Okta Research had warned of a post-Christmas surge in coronavirus cases. They said families attending Yuletide gatherings, the rush of holiday shoppers, and the throngs of travelers headed for the provinces were just what COVID-19 was waiting for to mount a comeback. Last Wednesday, the DOH announced that COVID-19 cases jumped to 899, the highest in over a month, and the positivity rate had risen to 4.5%. Okta Research reported that the positivity rate was higher than 5% in Metro Manila and considered the increase as more than just a holiday uptick. Before that, the national positivity rate had been holding at below 5%. By World Health Organization or WHO standards, we had been doing fairly well in controlling the coronavirus from spreading. But instead of breaking out the champagne, we should be gearing up for another pitched battle because the local surge could soon be reinforced and even dominated by the Omicron variant. Omicron has been on a rampage around the world, with case numbers swelling by 11% last week. Between December 22 and 28, the average rose to 935,000 cases a day. The United States, Britain, and several other countries have posted record highs, and the WHO has warned of an Omicron tsunami. Global travel is almost in bedlam. Thousands of flights were cancelled because scores of pilots and flight attendants called in sick after catching the virus, and hordes of travelers were stranded at airports. Governments which had relaxed anti-COVID protocols are bringing them back. Masks are now mandatory in Paris, and violators face a heavy fine. Cuba has stepped up booster vaccinations. In Greece, bars, nightclubs, and restaurants must close at midnight. WHO Chief Tedros Adhanom Ghebreyesus believes the twin threat of the Omicron and Delta variant is fueling the new coronavirus wave. This is and will continue to put immense pressure on exhausted health workers and health systems on the brink of collapse, Ghebreyesus warned. The Philippines has so far detected 4 Omicron cases, all arriving on international flights, but we should not be lulled into believing that we will be spared on the variant's wrath. No borders are now safe from Omicron. We just have to be prepared for it. But first things first, Delta must be prevented from resurging. Granular lockdowns proved to be highly effective in containing COVID-19 to specific communities. It could work again. Manila recently imposed local lockdowns in 8 areas where COVID-19 cases were slowly climbing. Other municipalities could resort to granular lockdowns to head off another COVID-19 wave. The objective must be clear: deal with Delta before the full brunt of Omicron arrives and prevent the 2 variants from joining forces. If that happens, the coronavirus could take longer and harder to confront. The government should also prepare for the expected onslaught of re-energized virus on the country's healthcare system. Delta cases almost overwhelmed hospitals before. The DOH assures the public that there will be no reprise of the ordeal. We hope that the assurance holds up. The key piece in a strong defense against Omicron is to vaccinate as many of the populace as possible. The government appeared to have surmounted initial setbacks in its inoculation rollout, from supply chain glitches to vaccine hesitancy. It is still short of target, but not by much. The government is confident that immunizing more than half of the population can be achieved by next year. There is one issue that clouds the global vaccination picture. WHO's Dr. Tedros said the large-scale booster campaigns of richer countries were likely to prolong the pandemic. He said boosters were diverting doses away from poorer, less vaccinated countries, giving the virus more opportunity to spread and mutate. But wealthier nations like the US and Britain countered that they need booster doses because regular shots may not be enough to protect their populations from Omicron. That does not bode well for countries like the Philippines, whose stockpile of vaccines is dependent on their availability in the international market. And that's the editorial for Friday, December 31, 2021. For more news and information, get a copy of the Manila Times on print, subscribe to its digital edition, or log on to www.manilatimes.net. Follow us on Facebook, Twitter, or Instagram and listen to the Voice of the Times.